My name is Deo Agaba, and I belong to the 2008 cohort. That is many, many years ago. I work with PATH. PATH is an international organization mainly specializing in public health programming, and I work as a regional advocacy and communications manager for East Africa and Southern Africa. Just a few countries, not all the countries in the regions here. I'm privileged to host Peter.
Thank you.
I'm expecting another guest. I don't know whether she's caught up in jam. She's called Edith. So want to just spend some few minutes talking with Peter and Edith, just to hear from them about how Save the Mothers has impacted their lives, but also specifically looking at the change projects they have been engaged in. Peter has the longest story I've been told. I don't have any clue about what kind of story he's going to tell. I'm also new to the story. So Peter, first of all, tell us about yourself. I don't want to assume that everyone here knows you. In 1 minute, who is Peter?
Thank you. I am Peter Olet, an alumni of Save the Mothers MPHL program that I joined in 2018. I am born of Oyam district in northern Uganda, with a background of teaching and development work. I've also had some opportunity to work with some NGOs in psychosocial programs, some health programs, education programs, and a founder of a private not-for-profit, Health Center 3, which is still running up to now, and I am the administrator.
Where did you get the money to start a Health Center 3?
It is through the engagements with the community. Having had opportunities to interact with the community in different, actually, as I've just said, having worked with some NGOs, having more opportunity to interact with the communities, I realized that people are really very much important to tackle their own issues. And there's need to invest in that.
I'm looking at the money element. How did you mobilize the money to start a Health Center 3?
We started in the meetings. Mm-hmm. Actually, the first meeting was in a church, where I introduced the idea of having a health facility in that rural area where I was coming from. And the question was, how could we start with this? So eventually, we started discussing this idea. We took the legal aspect to introduce the idea to the local authority at the sub-county level, which that line continued to district level. But also beginning to network with our friends who are just community members around there. And we thought of the idea of starting locally to have a place, first of all, the land, allocated land that somebody offered to put the facility. After that, we went into beginning to collect some fund and making bricks. Before we even talked about money, we talked about the materials we need that we can make locally. And that's how we started. Okay, thank you very much. It sounds like it's a very long story. Yes. In the US, they call you Pira. Yes. Okay. So tell us about I've heard about your chicken project, something, I don't know anything about it. You're going to summarize it, but tell us the gist of it so that we can go with something. Thanks, Dale. It's so interesting. This has come from an experience of trying to lobby for donor funding for 3 consecutive times, but failed. These 3 consecutive attempts, we wanted to upgrade the facility, but first of all, to have a maternity ward, and we would have a theater as well. So all these 3 attempts was looking forward to getting funding for a theater and maternity ward. After failing these attempts, and this is a real health financing issue in the country, where we look at the government funding, the government facilities directly, but also under the partnership, the public-private partnership. There's also support to private facilities. Now, quite a number of issues and experiences we were going through could not allow us to sit back other than thinking about having a theater and a general ward this time so that it can enable us upgrade and have more comprehensive maternal, newborn, and child health services for our community, because personally I have witnessed through different meetings and the DHIS2 system in our district. The most recent one was the death of 7 mothers in Oyam district in a period of 6 months, from July to December 2022. And out of the 7 deaths, 3 were community deaths. With that experience, also having sat many times in the MPDSR meetings at the district level, the maternal and perinatal death review and surveillance, similar issues would always come, and they were more related to delays, poor quality of care to these mothers at lower health facilities, and issues around transport, about referral mechanisms to the high-level facilities where mothers and newborn could get more quality, comprehensive services. So from this, we started engaging with the community members and the stakeholders, the local leaders, and sub-county and district leaders, including those directly in health. And a number of meetings, I introduced the idea of saying, why not locally have a system that we can raise some money? We have always complained we have nothing, but we have chicken at home. Every household you move around, you would find at least a chicken in our community.
And a duck.
And a duck, possibly. So now, why can't we use this chicken and start something locally, and we have our health system improve in this community? People thought it was a joke, but I kept emphasizing in these meetings, and we said, please, let's give it a trial. We started calculating. I took people through calculating using 12,000 households that we have in that sub-county. So now 12,000 households, each household to give a chicken worth 10,000 average. This would give us over 100 millions, over 100 millions Uganda shillings. Now, from there we started seeing a lot of sense, and people picked it up. We started locally contributing a chicken. This chicken, we set a committee that is able to receive and make sure it is sold. Fortunately enough, some of them are sold at 20,000, 25,000, 15,000, or 8,000. So the average is actually more than what we anticipated. This is how it continued to raise money. But leaving alone the chicken, there was need for us to engage in the direct hand-on work, such that we are able to dig the sand by ourselves, by the people around, and people agreed to take it up. It was done. So the money from chicken was used to pay transport, to transport the sand to the site. And also, engaging directly did not only stop in the digging of the sand, but also in making bricks. So the target was 40,000 bricks to raise that structure for a theater and general ward, which is a capacity of 55 beds. So this started well. The 40,000 bricks are already at the site and used. Actually, we are remaining with very few to complete the structure, which is at ring beam level now. You would see the pictures if it was shared here, so that you can see what it means by having such a structure and using local resources and local participation with our own people holding the hose and their own energy to take up this role. Eventually, we realized we would also get shortages with a bit of funds, especially when you look at buying some materials from distant places, especially like the cement. We could not make cement locally. So eventually we had to go into another system using the media to link a friend and improve our health. Linking a friend started jokingly, but eventually we have already realized up to 490 members in that. So these members are the people around. And some of them are friends who appreciate the idea of improving the quality of health services, especially looking at maternal and child health in that community.
Peter,
so yes.
Now, Peter, 1 minute, strictly 1 minute. I've been warned, my time is up. Where are you heading?
It is nice to test practically what works. And here we are testing. We have seen that a chicken can work. Not only that, we have now attracted the attention of so many people with a chicken. In our district, we had already organized a fundraising, which was coming actually from the stakeholders. Say now, this time we need to come up and support. And we were organizing for this fundraising to help roofing the theater and the general ward and completion. So you can see that the power of enabling the community take up their own initiative to work out for a solution to their own problems can also attract attention of the stakeholders, the leaders, which is working well for us. And we are quite sure that with this initiative, we are able to move to a better destiny. Already, just one little more thing, we have seen that it is nice to test things that work well. For example, let's look at an ambulance, which is a Land Cruiser. To buy an ambulance is 160 million Uganda shillings, and maintenance per month might be 5 million. But what if you use the 160 million to buy 4 ambulances, vehicles that are easy to maintain and is able to reach out to so many clients, so many mothers in the referral mechanisms. And each time, for example, we have at Timagi, we have that kind of ambulance that we maintain hardly 200,000 shillings in a month. And you can see that this can work.
So you're talking about
yes,
second-hand ambulance?
Yes, not second-hand. A vehicle, for example, a Noah car, which is modified as an ambulance, and it is easy to maintain. You can get the spare parts from everywhere other than a Land Cruiser that you need to transport to Kampala, for example, from Oyam. Okay. All these kilometers, and servicing is in millions, not in hundreds.
Thank you very much, Peter.
I just conclude.
Yeah, I hope your conclusion will be like a second.
Yes. In conclusion, indeed, it is important that we engage the community. They have problems, but they also have solutions to their own problems. And this is where we are.
Okay, thank you very much. I think we've ended it on a very good note. Everyone now is talking about community-owned, community-determined, community-focused needs and solutions. I have seen it everywhere. All the leaders are talking about determining solutions from the community perspective, not prescribing from the top where we are always programming from, but sitting with people. Some people are talking about human-centered design, but it's about really the community that we're talking about. So thank you very much. I hope you have scripted your stories. They can still go in circulation. People can have access to your stories so that we have more and more people accessing them and learning from your experiences. Thank you very much.